Welcome, everyone. Thank you so much for joining us today. My name is Jessie Mandel, and I'm with Healthy Schools Campaign. And thank you so much for joining us today. This is our second in our two-part webinar series on funding and advancing equitable school-based substance use prevention and early intervention approaches. As part of our series for National Substance Use Prevention Awareness Month, we're lifting up schools' central role in prevention and early intervention. And so in today's webinar, we'll be sharing a new framing for addressing youth substance use that focuses on equity and non-punitive supports and policies. Over the past 2 years, we've worked alongside a community advisory board to explore a vision for substance use prevention and early intervention in schools. And we've also held a series of focus groups with students, with parents and caregivers to discuss in more detail how schools can build trust and increase student engagement. Today, we released our report with our findings and related companion tools, and we're so excited to share these with you all and discuss this together today. Before we dive in, I just first want to acknowledge the many individuals who contributed to this project, who shared their experiences and their expertise with us throughout this project. This series was produced with generous support from the Foundation for Opioid Response Efforts, or FORE Foundation, the FORE Foundation. And we're just so grateful to everyone who supported this project, giving their time, their resources, and their insights. For those of you who were not familiar with Healthy Schools Campaign, or HSC, we're a national organization based in Chicago, and we work at the intersection of education and health, equity, and sustainability. We advocate for school health services that are sufficiently and sustainably funded and that are accessible to all, where all students have equitable access to and outcomes from health services in schools. Now, before I review today's agenda, I want to mention a few housekeeping items. First, this webinar is being recorded, of course, and we will be emailing out the recording slides and additional resources after this webinar. Also, you can submit your questions at any time. You can ask questions in the Q&A box feature, in the chat feature. And we'll be doing our best to answer all questions. And if we don't get to a question, then we'll follow up with you after the webinar or follow up with the full audience if the questions are applicable to all. So now I'm going to review today's agenda. We're so thrilled to be joined by just some amazing folks. We'll first hear from Alison Sutter with the FORE Foundation to really help set the stage and share some opening remarks for our discussion today. And then we'll be joined by Kimá Joy-Taylor on this project team to give some background about the actual project and our process, and then moderate a discussion with just an incredible panel of leaders, thinkers, advocates that have been part of this project in the Community Advisory Board. We really have such an amazing panel. We'll be introducing them later, but I'm so grateful for them to be joining us. And then we'll hear from Eggleston, also on this project team with us, to walk through some of the resources that we've developed to help put this vision into action so that we can really apply this new framing and what we're discussing today in our own schools and communities. And then we'll have time for Q&A, and we invite you all to be part of a discussion. We really want this to be a discussion together. So we're looking forward to having that. And of course, please put questions in at any time in the chat or Q&A feature. And now, briefly, before we dive into today's discussion, I just want to briefly recap our webinar from last week, where we discussed how states can increase funding for substance use prevention, the ways in which Medicaid can help support the kinds of school-based approaches we'll be discussing today. Sustainable funding, as we all know, is so key and so hard to come by to build the kind of trusting relationships, the equitable programs and services we'll be discussing today. and that we know so many schools want to do. So if you missed last week's webinar, we encourage you to check it out to learn about how state choices and state policies can help school districts fully leverage Medicaid to sustain and build substance use services. And with that, I'd now like to bring on Alison Sutter to help set the stage and share some opening remarks. Alison Sutter is Senior Program Officer with the FORE Foundation and just has a breadth of experience in this area. So thank you so much, Alison, for being here.
Yeah, thank you so much. Hi, my name is Alison, and I am the Senior Program Officer at the Foundation for Opioid Response Efforts. Many thanks to Healthy Schools Campaign for hosting this webinar today, and thank you all for being here. The Foundation for Opioid Response Efforts is a national grant-making foundation, and we support innovative solutions to ending the opioid and drug overdose crisis in the United States, including work to expand evidence-based substance use disorder prevention and early intervention services for students and young people. And at FORE, we're committed to promoting equity by focusing on groups that receive the least attention in responses to the opioid and overdose crisis, and who are most impacted. And we have been very proud to partner with Healthy Schools Campaign to advance equitable school-based approaches to youth substance use. So as we discussed in the first webinar, Medicaid is a promising, sustainable source of funding to expand access to school-based early intervention and prevention services. I don't have any slides, I'm just doing a few intro remarks. So Medicaid is a promising source of sustainable funding to expand access to school-based early intervention and prevention services and support equitable outcomes for the diverse young people who receive school-based healthcare and prevention services. And we know that there are racial and socioeconomic and geographic disparities in youth overdose death rates, exposure to adverse childhood experiences and trauma, and mental health concerns, which is why it is so important that Healthy Schools Campaign is ensuring that they apply a health equity lens in their work to expand substance use prevention, early intervention, and treatment. And we're so grateful that the speakers on this webinar are offering the resources and guidance that schools and communities need to develop culturally sensitive services. So thank you all so much for being here, and I will turn it over to our presenters.
Thanks so much, Alison. And now I will turn things over to Kimá to moderate this, to provide some background and then moderate our panel. So Kimá, thank you. We're not doing formal bios, but you are amazing. All of our speakers are, and we will be sharing the bios so you can see the full list of all their incredible accomplishments. But Kimá, thanks so much for taking the reins and moderating in this next portion.
Wonderful. So thank you so much. And thanks again, Alison, for supporting this work. And I'm going to give a brief overview of the paper, but it will be brief. So I suggest that you go onto the website and read it, and then really open it up, as Jesse said, for a conversation with some of the members from our community advisory board. So when we started, as Jesse said 2 years ago, we embarked on this work with the question of what does community-centered vision that leads to positive and equitable substance use early intervention prevention services, like what does that look like? Our current stats show that what we're doing now is not working. It's not effective for everyone. And it's not achieving the wellness goals that we hope to see. So we need to start thinking differently and engaging the very people that we say that we're helping and partnering with to really see how we can improve outcomes for youth, parents, caregivers, and families. We also started this work because even in the midst of an overdose crisis, substance use is often left out of broader health and mental health conversations. Folks say it's included, they'll be like, yeah, we're doing mental health and that includes substance use, but when you drill down, it's not actually addressed. And we as a nation, have to proactively include substance use prevention, early intervention, and all the policies, practices, programs that are going on in these other youth health and well-being programming. This will require us to be honest about the different and punitive policy and program responses that are often disparately applied within the substance use field, including in schools. So this paper, while limited in scope, sought to ask diverse community members through interviews and focus groups what they wanted to see from substance use prevention and early intervention work, and what would help them to engage in such efforts so that we could start to reverse some of the poor and disparate outcomes. The work was led in partnership with a diverse community advisory board, some of the members whom you'll meet here, who come with different perspectives and expertise to this table, but all of whom centered youth well-being in everything they do. So substance use prevention and early intervention is part of a larger context. We were not looking to identify programs that were one and done. We know that's not effective. Nor are we asking schools and teachers to say substance use and just use that word in every sentence, but instead really sought to think about and to identify ways to embed prevention and early intervention work in all that is done. And this type of work really requires, and I would say this is kind of first and foremost, but engaging youth, caregivers, parents, and asking and understanding what their needs are, what they want to see, and how they want to engage. And we had some great feedback from folks who were like, yeah, there's these add-on programs, but we're parents and we're tired. Like, put it in the places we're already going to be. So how do you want to engage? And knowing at times that sometimes it is the caregiver and youth interaction that could be causing some of the stress, and being really honest about what that looks like in the services provided. Working with new partners, work requires working with new partners and sometimes engaging old partners in new ways and really hoping to use the breadth of their creativity and curiosity. Requires work recognizing that we need a school community response, one that includes all school staff, youth, parents, community members who are in contact with and helping youth. Sometimes teachers and principals may not be the best or the sole leaders in the creation of policies, programs, responses, or engagement. Requires identifying a need for and different strategies to earn community trust. Trust that has been ruptured often, and not just the trust of the young people, but also the trust of the parents and caregivers and families. And how do you understand and how do you identify and develop strategies to start earning that trust? And then finally, requires changing discipline policies so folks will come in and feel they can ask questions and ask for help and won't be punished. And we're requesting help that is accurate and informative. So I want to be clear, this conversation is not to provide all the answers. You have to talk to your community, but it is an invitation to think about and see ways to shift practices and policies in ways that can equitably improve access to and outcomes for all kids of all races, ethnicities, gender, sexual orientation, disabilities, ages, and other intersectional identities. Because as you know, this work isn't just about getting a reimbursement. It's ensuring that programs we put in place and get reimbursement for are actually achieving the equitable outcomes we hope to see. So with that framing, I'm going to open it up to our community advisory board. And as Jesse said, we're going to send out longer bios later, but I'm really honored to sit in conversation with these folks. And I'm going to list them and then start asking some questions. So we have Meyiya Coleman, who's a youth organizer, Deborah Mattheus, who's the University of Hawaiʻi and Mānoa School of Nursing, an endowed professor of school health. Chelsea Prax, who's the director of Children's Health and Wellbeing for AFT, and Kayla Tawa, who's a policy strategist for the National Collaborative for Transformative and Youth Policy. All of these people are amazing, and as much as we'll send out the bio, it is actually worth like looking in and seeing the work they do because you will be completely wowed. So I'm going to ask, as Jesse mentioned, I'm going to ask the panel some questions. And first, I'm going to start with Deborah. I call her Deb all the time. Deborah, from your perspective and the work that you do, who should be at the table, and when should this work start when we're talking about substance use prevention and early intervention?
Great. Thank you, Kimá, and aloha to everyone from Hawaii. Being that I've been a nurse for over 40 years, I really encourage everyone to start with an assessment. Really, that assessment that you're going to do will help you objectively identify your current assets and resources that you already have and the unique needs and concerns that currently exist within your school or your community. So I always say, ask yourself, who are the people, the schools, community resources, and health professionals that already exist in this area of substance use prevention? And then I'm sure that you can identify some of those champions that are already doing this work in this area but also the bigger picture in terms of keeping kids healthy in school and ready to learn. So then I want you to then also ask yourself, who's missing, right? Who are those people that are critical and their voices are needed to make both acceptable and sustainable changes? And again, I want to emphasize, let's make sure that we have those voices of those students and those parents. And oftentimes we don't get to the table with our students and with our parents until there's a crisis that actually occurs. So once you've made that assessment, you can begin developing with your team your goals that help to divide or create that plan and direction. And I would say the earlier the better. So prevention education, as a nurse and as a director of a school-based health program, really encompasses early education down to that elementary school where we're developing and promoting overall health, well-being, and helping these students to learn how to navigate challenging situations. Now, we all know that these steps are going to look really different in each of your environments, but I think the important thing to be thinking about is including all those voices and honoring everyone's contribution so that you can build a stronger foundation and have more of those champions over time to make the impact that we need to in substance use prevention and overall health for our children. Thank you.
Wonderful. Thank you. And I should state for these panelists, like, as I'm sure you know, they're not just talking to talk, like these people have done the work. And so that's why we really wanted to have them on board to give you some of these pointers, because this is doable. So the next question I'm going to pass over to Kayla Meyiya, and you guys can decide who answers first. But what are some of the lessons you've learned? We all said you have to talk to the youth. It's not done as much as we should, but we all know we should. And so what are some of the lessons you've learned in your work around youth perspectives?
Meyiya, do you want to jump in first?
Yeah, I can go. I definitely would say something that I've learned is meeting young people where they're at. I think that a lot of the times adults kind of expect a certain thing out of young people with like trust and all of those different things. And honestly, young people don't just trust you like that, right? So meeting young people where they're at and not overly expecting young people to be so trustworthy. I think that's something that I've learned in my work a lot as a youth organizer. I would also say kind of allowing young people to tell you what they want versus just letting young people, you know, telling them what they want. Hey, you need this, you should do this. Young people, a lot of the times, no, right? I think that putting the pressure of telling young people what they want kind of has them closed off to a lot of adults, and this is why we're kind of running into a lot of I would say a lot of aggression with young people when it comes to telling them what they need and what they should do versus asking them, you know. And that comes from a simple conversation. Hey, how are you feeling? What can I do for you? Are these some things that can help you? If not, what do you need? Right? I think that that is something that I've learned a lot in my work when working with young people. I think lastly, I would probably say, and I think this was something that I had jotted down the other day, was kind of allowing space for growth as well as space for conversation. Young people need to feel purpose. As a young person, you know, myself, well, not anymore, but I really valued being in spaces where I found, you know, my purpose. I was going through a lot of trauma and things like that, and I really found an outlet with letting other young people know, like, hey, I was dealing with this, I got through it, and so can you, you know, and taking that to legislators and allowing legislators to hear my testimony and my story. And that's where I found my most purpose, and a lot of my healing came from that. And I think that that's so valuable and so important to let young people get into those spaces where they find purpose. So I would definitely say those are a lot of the lessons learned. A lot of bumps in the road, but a lot of things have been overcame when learning a lot of these lessons. And I'll pass it to you, Kayla.
Thank you. Yeah, I first of all want to second all of that. And then I will just add some lessons learned from kind of across the spectrum of all of the mental health work that we have been doing at the TIP Collaborative over the past very many years. A couple themes that have just kind of come up again and again and again across all of our conversations with young people in terms of what they're looking for with mental health policy. And so the first one is across all of our conversations when we are talking about what are the root causes of young people's mental health challenges, the same three things come up like across time, across geography, across like all of these things, right? And it's poverty, racism, and community violence. So the first thing is to really make sure that we are not pathologizing young people's mental health concerns and we're recognizing that they're rooted in these very real systems of power and structural issues. And we really have to be getting at the root causes of these things and recognizing that young people are existing in the world, they're experiencing all the things that are happening in their communities, and they are responding to those things in ways that make sense. And so to really just keep your head on kind of those bigger things of poverty, racism, community violence, and kind of all these other things that fall under that, things like the climate crisis and like all of these things that are happening that young folks are experiencing. The second is in terms of the kinds of supports that we're offering. And again, we hear, and I think many of us also feel this ourselves, there is a well-rooted distrust in many clinical supports and models because these systems have historically harmed communities and continue to harm communities. So it's making sure that we have a broad spectrum of mental health supports, including non-clinical supports, so that everybody can access a support that is healing for them. And the last thing is just to really focus on prevention and well-being and recognize that everybody is going to define healing in their own way. And we have to be able to allow people to get to their definition of healed and healing versus trying to have one definition of healing that we are applying onto everybody else. So
Oh no, did she just freeze?
No.
Okay. Oh no. We'll come back to her when she unfreezes, but I think we understand the point that she was making. And so really want to thank both of you because it gets back to really centering the people we're talking about, right? Like you have to actually talk to and engage with the youth you're serving, not talk at and tell folks what they need. And so along those lines of engaging and having trustful and honest conversations and recognizing reality, I'm going to turn to Chelsea. And the question here is substance use is different than many other health concerns because admitting this health concern often leads down a punitive discipline pathway, often with disparate application. Why is it important to look at the discipline policies as we talk about substance use prevention and early intervention services in schools?
Thank you for this question. And welcome back, Kayla. We lost just the very tip of your message. So before I try to take on what Kimá asked me, do you want to revisit what you were trying to say with us?
Thank you.
So sorry, everybody. I don't know what happened to my Wi-Fi, and I'm not sure where I lost you, but I think the last thing I was talking about was just allowing folks to define healing on their own terms and not kind of imposing one definition of what healing is across the board. But thank you so much, Chelsea.
Of course. These are key ideas. So the question is around punishment, and I want to just take a step back for a moment and acknowledge sort of how I come into this work. I joined the advisory, I think, as a person with a master's in public health, as someone who does a lot of health in schools work, as someone who used to be an educator, and I felt kind of at a loss. I came into a room with like heavy hitters who had been doing all this work in substance abuse and substance prevention. And I was like, oh, I don't know what to ask. I don't know what to do. And so I want to start by naming that some other folks who want to be advocates and who are educators and who would come to this space are maybe coming with that sort of energy, that it feels different and it feels more scary and it feels like I have to catch up on more literature, or I have to do some reading, or I'm not there yet. And I want to name some things that I have learned and really had folks underline for me in this process that I think helped sort of close the gap. Kayla has already said some of this, and Meyiya has already said some of this, and I think Kima's questions are setting it up. But again, to name substance abuse, substance misuse, substance addiction, substance use disorders, these are all things that should not be scary. And we have to give ourselves permission to take a deep breath when we are faced with young people using substances, to treat this as another chronic health condition, to not go to panic. Because I think that our culture sets educators up, sets adults up to care for children, and to think that caring for children means this is scary and I have to shut it all down right now. And I want us all to just like have a moment to realize we would never respond to a child getting a diabetes diagnosis with panic that in the same way, with like, I have to stop you. I have to shut down your behaviors. It's okay to recognize when our young people are unwell. It is absolutely appropriate to recognize when our young people are not having the outcomes that we wish for them and not having the outcomes they wish for themselves. That there are pieces of that, as Kayla was saying, that are massive and structural. They are about racism. They are about poverty. They are about the ways that we set up children and families to fail. And sometimes in those systems, young people don't make the best of decisions. And so sometimes there's some agency involved and they need some coaching and they need some support. And at no point, if we step away from the idea that fear, it should drive us, or fear should drive our response to young people, at no point will we come to the conclusion that punishment will be effective. And there's also an abundance of literature that says punishment will not achieve any of the things you want. It cannot help make children well. It will not stop them from risky behaviors. It cannot prevent disordered use. It cannot prevent overdose. It cannot prevent death. Those are terrifying things. But if we're serious about not letting them happen, we also have to be really serious about leaning into prevention tactics and intervention tactics that actually reduce the harms that scare us. And punishment, whether it is not speaking with that young person, pushing them out of school, pushing them towards, clinical health systems, which, as Kayla was articulating, are not always in service of well-being. If it's pushing them towards child protective services, if it's pushing them into juvenile courts, these are all punishment mechanisms that rely on fear and act after the harm to enact more harm. And that's not going to get us to a solution. We need instead to be motivated by asking, what can we do differently for the next young person who maybe starts down this pathway? And what is the harm that I can fix right now? Sometimes it doesn't feel like a good enough solution. It's getting a clean needle instead of a dirty one. It doesn't feel like the best solution, but sometimes that's the way that I can reduce harm in the right now. And then once I fix that harm, I can think about the next step, and I can think about the next step and the next step. And I think that the broader lens that I just want to really invite us to borrow and to lean into is that prevention and punishment cannot go together, and punishment can never get us to well-being.
Yes.
Thank you. Oh, go for it, Kayla.
Sorry, I'm sorry about my Wi-Fi. Yeah, I think that exactly what Chelsea said at the end is kind of the point I wanted to make, that, oftentimes these things are happening on two separate tracks, and you have all of this school hardening happening and all these conversations happening about school climate and school discipline, and you start to see, surveillance of students in schools, and now there's like AI surveillance and all of these things that are happening. And then on the other hand, you have all these people having these school mental health conversations and figuring out what supports to bring in and all of these things. And those conversations are not happening together. And we know that all of these school hardening things are harming students. and are worsening their mental health outcomes. And so then you look at the school mental health supports and they're like, it's not working and all this stuff. And they're not looking at kind of the broader picture of what else is happening to students in schools. So I would just say it's really important for the school mental health folks to be in those school climate conversations, to be advocating against these school hardening measures, and to kind of recognize the full scope of what's happening. And to make sure that, you know, we are not reframing school hardening as a school mental health support. And we also know that, you know, it is things like prevention get defunded all the time, and the school hardening measures just don't. And so it's important to make sure that we have the data to back up that these things are working, and if they're not working, why they're not working, and what else is happening that's making students less safe in their schools, and then having whatever the mental health outcomes of that may be, and to not tie all of that to prevention isn't working or whatever else the narrative may be.
Wonderful. Yeah, and I think, you know, Chelsea also mentioned something about how at first she was intimidated to come to the space, which I find amazing, because I will say I was intimidated too, right? Like all of these really great minds thinking from many different perspectives with the same ideal for you to be well. And so I think sometimes we don't do these cross conversations because people are afraid. But when we work together, like we can do this. We have the knowledge, we have all of it to really center our youth and their well-being. And we know that schools are stretched and they have many challenges and all of it. And so the key, I think, is to just start somewhere. Sometimes people get so overwhelmed, they're like, I can't do anything. And so I would love for each of you to give a statement about, like, if there was one place you thought schools should think about and schools should start if they really want to look at, again, it's not just about reimbursement, it's reimbursement that's going to actually achieve the goals that we hope to see, which is these equitable well-being and outcomes. What would that be? I'm going to start with you, Meyiya, just because you're next to my screen.
Yeah, I think that somewhere that schools should start is just having, you know, those uncomfortable conversations first. I think that that's very important. I worked in a school for maybe about 2 years. We were doing like a civic engagement programming, and I felt like the teachers were trying to put a blanket over substance use. And I just quickly told the teacher, hey, we're going to not sugarcoat this. We're going to actually have an uncomfortable conversation, and we're going to start with the root causes of why young people are using substances. And I just, you know, asked the question, how does it make you feel? You know, and they were like, oh, it makes me feel good. I use substances because sometimes my friends aren't doing it. Sometimes it numbs me, all of these different things. And I think that that day after having that conversation with the young people, it even opened the teacher's mind, because she was just like, oh, you know, I thought that this was just something that was fun for them. But she later found out that it wasn't just fun. Young people were dealing with traumas, you know, their friends were passing away. Their family members, they were, you know, not able to deal with a lot of these things. And just even being relatable, at one point in time I was indulging in substances as a young person, because I had went through things like my cousin had went missing and was found in a garage behind my house, and different things like that. And I kind of, you know, opened up and got vulnerable with the young people and kind of, you know, started there. Let's get more vulnerable as well, because young people want to see us in vulnerable spaces so that they're able to open up. And if we, you know, have these uncomfortable conversations, yet intentional conversations, we can have so many different things that are tackled at the root. So I definitely think having, you know, those conversations and starting with conversations in the classroom, in the classrooms, and, you know, having those conversations with young people, and kind of asking young people, what do you want to do about this? What are some suggestions that you have to, target this and make sure that other young people aren't going through these things? And if they are, how do we assess the situation so that it doesn't get any farther? So I would definitely say those are some of the suggestions that I have with where to start.
Awesome. Thank you. Deborah, you're next. Where would you
Sure, thank
start?
you. One thing that I do want to say is what we've learned with a lot of the issues that we're dealing with our students related to mental health is that oftentimes the teachers in the schools, as well as our nurses, didn't have the education or the comfort to ask those questions, to engage youth. So part of this is really then building and educating those that are in the school environment to feel comfortable, as Chelsea was saying, to speak the language, to talk about this so that they can say the right things, bring the youth so that youth feel comfortable coming to our clinics and that they have a voice and that they understand that if they come into the clinic, they're not going to be asked 1,000 questions. What are you doing? What do you take? Asking them, what do you need? Why are you here today? Hey, do you want to just hang? Are you just feeling a little stressed? We have now de-stress rooms with headphones for kids. We have fidgets. We've put a lot of things into place, not because it's what we thought worked. We asked the youth. We even engaged them in creating posters about what are the issues that are important to you and your peers. And they did remarkable work and they want to be engaged. We need to just make sure that we bring our people together and that also that the people that are in that school environment also feel comfortable with those topics. We continue with that, with educating all of our nurses in the schools. And many of my nurses have now gone back to become psych mental health nurse practitioners because they were like, all of these kids, they need me. I need more skill set. I need to work on this, right? So it's really just building those teams and champions so that when those youth are there, they feel comfortable and also that the parents feel comfortable talking and engaging, bringing them in as early as possible. And that's what we're beginning to recognize. Once you start to build that trust at that early age, again, you just continue to have that openness within our cultures and hopefully an opportunity to make some changes within the system.
Wonderful, thanks. And part of that is getting to what Chelsea was saying, getting them over the fear, right? To have those conversations that Meyiya is talking about. Okay, Chelsea, your turn.
Thank you. I'm gonna, again, sort of come at this from a little bit different perspective. If you are a third grade educator, if you are a paraprofessional, if substance abuse is not what you're dealing with on a day-to-day basis, the recommendation is not necessarily that every circle you lead with students now needs to like introduce, how do we talk about marijuana? Or that if you are a high school psychology teacher that was like never otherwise going to talk about this, that you should rewrite your entire curriculum and like start again. It's not necessarily that. Some of what primary prevention in this space looks like is the same as for lots of other health issues. The basis is strong, trusting relationships that have shoved shame into the next realm. And you will not know necessarily that you are the adult that a young person has a strong, trusting relationship with that has no shame in it, unless you are vulnerable and open and willing to talk about really difficult things. One of those really difficult things might be substances. One of those really difficult things might be community violence that's going on and that has happened recently. One of those really difficult things might be death. How do we talk about death? That's a training that I coordinate at AFT. As you build in, and I think this sort of begins to speak to Dennis's question, there are lots of schools that are doing good work. The evidence shows us that children's outcomes are not matching our intentions. And so the work that we're doing may be good, but it's not good enough. I don't think we get to be satisfied with it at this point. And I think, when Kayla was talking about, as we look at school climate, really deeply embedding vulnerable questions for the institution, for the educators, for the adults, not do the students like it here necessarily, but do they trust anyone here? can we find a way to even ask them about it? Because if they really don't trust anyone here, they won't tell us about it either, right? How can we build a climate where our young people are coming to at least someone and saying, Miss Kimá, I feel okay telling you this, but I don't want you to tell Miss Deb. Well, this sets up an interesting power dynamic between adults, but it's also starting to get at the proof of, you trust me enough. I am honored to hold something heavy for you. This is where we start to get really, really powerful conversation potentially happening. And again, where not treating that vulnerability from a young person, that establishment with punishment, becomes essential so that I don't shut it down. And I don't say, well, you should have trusted Miss Deb. You got to go to her too. You got to do, I don't know what. I've introduced shame into this conversation, and I've ruined something that could have been beautiful. I've gotten in my own way. I have interrupted what might look like a fantastically, what's the word? A program with fidelity. It might look like I'm doing it, but that kind of conversation has shut down what we know we need to be getting into. So my answer really here, again, I'll say it, primary prevention for substance abuse, for substance use disorder, for the outcomes that frighten us, looks the same as for many other health issues, and is grounded in strong, trusting relationships that very purposefully do away with shame and end silence around things that are really challenging for us.
Awesome. Thank you. And last but certainly not least, Kayla.
Yes, I actually want to say two quick things, kind of pulling everything here together. I think the first on the youth engagement piece is to be prepared to not only listen to young people, but to implement what they're saying, even if that looks very different than maybe what you had originally planned. And I think going back to the very first thing Meyiya said around building trust, I think if you're asking people what they want and then you don't implement it, that's a really great way to break trust and to make it a lot harder to go back to young people again and again and again if they know that you are not interested in implementing their ideas. So that would be the first thing. The second thing, kind of from this broader policy perspective, and really going back to what Chelsea was saying, is, oftentimes we have these policies, and when you look at how they're being implemented, it may not be what the intention was, or, all of these other things. And so to start thinking about how you can map all of the different policies that are happening in your system to better understand what's holding the system in place, right? Because it's not just what are the mental health policies, it's also what are the school discipline policies, it's also how are schools getting funded, what are the priorities for teachers from the state, how is teacher mental health, like all of these things that are interacting with each other. And so oftentimes there's this idea that there's like one policy you need to pass and it's going to change the whole system, and really it's just one more policy you're adding into this tangled web of policies that are misaligned and are all doing different things. And so to really start to understand what's holding the system in place, and then from there, what policies are needed to have the biggest impact and to actually transformationally change the system into the system that you're trying to build. And it just takes, like we've all been saying, a much broader and a much more holistic perspective to understand how all of these things are coming together to create the situation that we're in now.
Awesome. Thank you. And I will say, I'm going to turn it to Alexa, but I do want to say at this point, really thinking for, and it's a way to think for schools to think moving forward in terms of where to start putting together a knowledgeable, diverse community advisory board to help you understand and see things differently and hear from youth voices on even the questions you should ask, right? How you should start thinking about things. So I want to thank FORE and any other funders that allow for that to happen. But I think both Chelsea and Kayla kind of gave a good segue also on like some of that deconstruction. And so I'm going to turn it over to Alexa because she's going to talk about a tool that we put together thanks to the advisory board. Where'd she go? She's going to be spotlit any minute, I'm sure. But a tool that was put together, and then we're going to open up to question and answer.
Great. Thanks, Kimá. And I also want us to start by giving one more round of thanks to our panelists here today, certainly the funder and my colleagues that have been all working together on this project for the past couple of years. It has very much felt like a real labor of love among a group of people that really care about young people. And it was really an honor to be a part of it and to bring the vision of this group into fruition. And so I'm going to spend just a minute or two talking about another direct output, I guess I'll call it, of the work that we did together that actually wasn't part of the initial plan and really came from the specific conversations that we had and recommendations of the group. And that is the development of an action tool that's available on the website. That again was really designed out of the conversations that we had with the community advisory board and a request to have a user-friendly, action-oriented tool that could be put in the hands of people immediately to begin the conversations that you heard a lot about today and begin to identify some real concrete action steps that can be taken towards improvement. It really, was an opportunity to take all of the great vision that you heard today from the panel and again, to really put it into action. So this information gathering tool is really designed to help you assess, for lack of a better word, understand, really identify, really whether your school and community practice non-punitive substance use prevention, early intervention, and treatment approaches. And again, I'm really emphasizing that the focus here was really on non-punitive things that schools could be doing because of what we heard today, and really to create the space for the conversations that we heard from our panelists today, the space that's really needed in particular to engage youth and parents, but really the broadcast of characters that we need to come together to bring these visions to fruition. And so, as I said, it's really intended for students, parents, educators, school administrators, healthcare and community leaders, really literally anyone in your community that cares about this work and wants to start leading, really is an opportunity to bring them together towards this goal of really supporting student wellness. And while anyone can use the tool, and we really want it to be a collective effort, I think with, multiple and diverse people and perspectives, as a group, we really talked a lot about how cool it would be if this were something really youth-led and that young people kind of took the lead on working through and gathering folks and teams to really answer these questions and begin to understand what is and is not being made available to them in the context of their school. So the responses are really designed to help schools align their policies and programs with the vision that you heard outlined today and that's presented in the report that we just released. And again, really designed to help strengthen culturally and linguistically responsive services that lead to more equitable outcomes. There are 8 different sections. We really thought a lot about length and, how deep and how broad, but really wanted something that wasn't too long, but again, really provided an opportunity for a deep dive into a number of different sections. And so there's a whole section on youth engagement and what's happening in that space. There's a section around kind of targeted towards parent and caregivers and how they're engaged or not. There's a section on data and disparities to really help people understand those sets of issues. There's a section on school financing, so you can start to understand kind of how your school is or isn't financing these issues and tapping, resources that may be available. And those are just a number of the sections that we have included. Our hope is really that these questions inspire you all to think more critically and perhaps differently about substance use prevention and early intervention services. And as you heard today, again, really reflect on the broader school climate that's needed to support a holistic approach to improving student well-being. We really do, encourage you to make this tool your own and to think about ways to tailor it to your school or your community. It was really designed with that in mind. And so we really do kind of hope this is something that you can take, very quickly and start to use as kind of a call to action and rallying tool, I guess I'll call it, in your community. Finally, quickly, the other thing I just want to call out for folks, because there's a number of different resources that we developed as part of this project, is there's a link to also a set of additional resources that we have examples of different types of programs that we came across and were identified through these conversations some examples of funding potential, funding streams that also, hopefully is a resource to you all, whether you're brand new to this issue or you've been in this issue many, many years. There's a plethora of things that you can kind of peruse at your leisure and decide if they're useful to you. Not an exhaustive list, but again, just like a sampling of key resources that the group and ourselves really thought would add value to the work that you all are trying to do. So again, thank you all for your time today and participating. It's just great to have you all here. And with that, I think I am turning it back over to Kimá.
Awesome. And I'm so excited because we do have time for Q&A. So the first question is, do you work with state education agencies to get their support in implementing this into the curriculum? I think as we said, we're nearing the end of this 2-year journey, but I do think that is something that we do hope to do, and partnership with our CAD. And so that is something that we would love to discuss in the future. So now, and Elizabeth, we will take your name, but I want to open it up to another question for the panelists. How can, and I have ideas, but I think you guys are best situated to answer this. How can schools ensure substance use prevention is culturally responsive, especially if decision makers are predominantly white? Can you share examples of strategies that address the needs of students from diverse cultural backgrounds in such settings?
I'd like to jump in first. I think that number one, the identity of the leader, whether it seems to be the same or not as the target population, is too easy of an indicator to rely on. A lot of what I learned in this advisory is that youth of all different backgrounds have a different culture simply because of their age and because of their developmental stage. And part of learning their culture is letting them elucidate it. And so I want to give an example that is from my experience. I am a Black woman. I used to be a teacher with almost exclusively Black students, and yet their cultures were incredibly diverse. So I was thinking about this from the perspective of like picking a book that resonates with your kids. And I thought, well, a book about a Black person wouldn't necessarily resonate with them, because just off the top of my head, from one of the classes I taught, there was the kid whose name means second son in Japanese, who was amazing at cracking jokes, and his best friend, who was a skateboarder and had just figured out that he really loved journaling poetry. And the next person in the class, who was the daughter of Jamaican immigrants and like loved putting on new nail art every week and wanted me to like use a different nickname for her every week. And then the next person who came to me one week in a complete frenzy because his mother made traditional Ethiopian food, and he came to school and he smelled like onions, and he was just wildly embarrassed that that was what he smelled like, and could I give him perfume instead, because he would rather smell like a girl than smell like onions. And so they were all Black kids, but they didn't all speak the same languages, and they didn't all have the same immigrant backgrounds or non-immigrant backgrounds, and they didn't all have the same class status, and they didn't have the same interests. And to identify a culture that unified my students, I needed to listen to my students tell me what unified them, when and whether that was possible. And if there were 3 different groups of them, how they thought about that. Were they gendered groups or neighborhood groups, or we all like this music and no one listens to the radio anymore groups? I would not have known that, except for I needed to listen to them. And so I think wherever you are and whoever your administrators are, they're going to be successful in implementing responsive programming when they learn who they are responding to.
I can add something quickly. I think this goes back to kind of that allowing folks to define healing on their own terms, and really why it's so important to have a workforce in schools, a mental health workforce in schools that is diverse in both identity and credentials, because what's going to work for one person just isn't going to work for everybody. And it's just important to have that wide range. The one thing I will really advocate for is trying to create a youth peer support program in schools. I think that's one intervention that can have a lot of success because the workforce there is other young people. And so I think that, when you talk to young folks, oftentimes when they say, who they feel most comfortable talking to, it is their friends. And so that's kind of a way to tap into that workforce to provide training to young folks, and also to kind of create a workforce pathway for young folks into the mental health system. So that's one idea. That's not the only idea. But again, just really thinking about that diverse workforce in both identity and credentials so that hopefully everybody has at least one person or place on campus that they feel safe.
Excellent. Other thoughts?
I think for me, I agree with what both of these ladies said. I think I would probably also add just piggybacking, will probably just be before building those relationships and having conversations, because again, young people can tell you what they need and what they want. And if you're having those uncomfortable conversations about diversity and how can we make spaces more diverse, young people will be able to tell you exactly how. I think even going back to the lessons learned, being in a classroom where, as we can see, a lot of our migrants are coming into a lot of the schools now, and a lot of the schools are more urban. And so kind of having those discussions of how do we, make these spaces more available to you all to be able to learn equally, and having a sense of understanding between both race and gender, all of those different things, and making sure that we understand that we're all trying to come to a commonality of things, which is substance use, or even if we're not working on substance use, any other thing, right? And so making sure that we kind of have that conversation around the importance of understanding other folks' cultures and languages and all of those things. So I definitely think that having those conversations to see what is appropriate to do within classrooms and within spaces, and systems as well.
Wonderful. Deb, anything to add?
I just want to add that every school, every community is going to look different. So again, you create these toolkits, but it's really figuring out what do those people need and who's missing at the table, but every place is different. So it's not going to be a perfect fit. And we've learned that. We adapt, we readjust, we ask more questions. And it's hard work, but it makes a difference. And I think that that's where we all should be coming from. This is not going to be a perfect fit, but you got to put one leg on at a time, right? And take that step out and venture sometimes in that uncomfortable place and asking those questions. But I will tell you, it's amazing how thoughtful those youth are and how much they know what they need. And if we don't ask them, they're not going to just come to us and just say, hey, guess what? I want to talk about substance use today. I want to talk about mental health. Bring them to the table, and it's absolutely amazing. They are bright. They know where they want to go. They know what their peers need. And once you build that trust, that's how we get most of our referrals. Hey, so-and-so told me to come see you as the nurse because you're really cool and you'll just kind of listen and you're not going to judge me. And then before you know it, there's floods, and you build that over time. It doesn't happen like that, but those are the conversations that we need to have, not with just the youth, but with the parents, so that they feel comfortable that we're not just talking about their student, we're talking about family well-being, right? We can work with the student, but we've got to be thinking about the bigger context. What else is happening in that student's world that we need to really know about to absolutely be able to help not just fix, but make some changes in the community for better for all, for families and for the students.
Thank you. And we're at time. So I'm going to pass it back to Jesse, but I think you've heard some themes throughout this. And one, I want to highlight Deborah's last point. It's not going to be perfect. Every person has alluded to, you try something, you listen. If not, you have to try again, right? And it's so the deep humility, willingness to listen to others, willingness to be in those hard conversations, recognizing and celebrating the differences that exist and acting accordingly. But I want to thank the panelists. This has been amazing. We do know there are 1 or 2 questions that we did not get to, but we will try to address them and send out answers. And so I'm passing it back to Jesse.
Thank you, Kimá. And yes, just to reiterate that we will tackle some of the questions that just came in and vet them with the panelists. We actually talked about this beforehand, knowing we wouldn't be able to get all the questions in. So we'll put together an answer, and then when we share out the slides and resources, we'll share some of those Q&A questions that have come in through the chat that we didn't get to. But thank you all so much for this incredible discussion. This was really fantastic, and just appreciate the resources that have been shared in the chat as well. So thank you to Meyiya, to Chelsea, Deborah, and Kayla, and to our entire community advisory committee that joined and supported this project throughout. We just dropped their names in the chat too, so they can also get acknowledgement, because we really had such a phenomenal group throughout. And to everyone who, the parents and youth who've just supported this project, and of course to the FORE Foundation for sort of seeing the long game, for understanding that this work takes time, and for supporting that and having that vision. And then of course, thank you to Kimá, to Alexa for your incredible work on this, to Alison Paxton, who's been off screen. We have just a fantastic project team, and I'm just so grateful to have been working alongside all of you. So thank you so much. We have these resources that we will share. These are the project page. Oh, there it is. So all the report, the resources are all here on this project page. And please make use of these resources and give us your feedback too. We always want to make sure that they are in service to you all doing this work. So please let us know how they're working, where we can make changes. We always will update things that we can. And with that, I know we're already a minute over, so I will close this out. Please feel free to reach out to us anytime. Thank you all so much for being here. And I just hope everyone has a great rest of your week, and look forward to continuing this conversation over email and throughout the rest of the year. So thanks everyone. Have a great rest of your day.